morning video diary. Um, I had a session yesterday with a speech and language therapist. Um, the sort of Huntington's, in common with other neurological conditions, can affect your ability to speak, but it also, some of the cognitive problems in Huntington's can, things from poor working set memory, recall, the ability to remember a lexicon of words, and that can obviously affect your ability to communicate. I mean, there's also something additional in Huntington's, with the sort of the loss of fine motor control. It sort of affects your ability to control your throat, so it sort of impacts HD patients in a couple of ways. I mean, first, most obviously, it slowly takes away the ability to communicate verbally. Also, it can it makes it difficult to eat, and I think perhaps one of the reasons why HD patients are usually so thin. But also it can give a big high choking risk. So when eating or swallowing or those kinds of things, sort of poor throat control can result in things going down the wrong hole and causing the patient to choke. Like with all these things, this is early days for me. I'm only at the beginning of the disease symptom curve. I do sort of choke occasionally, maybe once every couple of days. Nothing major. Given me a choking diary to complete when I'm choking, to see what I'm doing and what I'm eating and things. My main thing at the minute is thing that's affecting my ability to speak is because everything is slower for me, so it seems to take me a long time to find the words that I want to say. And they've given me, the speech therapist has given me some strategies to use to try to help recover words and work out what words are that I'm trying to say. You got to remember, I mean, for for the last sort of 14 years or so, my career, I've been a technical architect, kind of an IT consultant, so presenting, running workshops, having meetings, that's all been a big part of my life. So I'm very proud of my ability to communicate, but it also means I'm very sensitive to any loss of ability in that area. So I've been reassured that I am able to articulate myself. I am able to communicate verbally at the minute. But like with all these things, like with the stumbling and other things, I'm noticing because it's affecting something that I'm very conscious of. Anyway, it's good to. It was good to make contact with a speech therapist to have that relationship, to make to get their services on board now, so I don't have to worry about that later on down the line. One thing we're looking at is something called a speech bank, where it's actually quite a new thing. It's actually it's quite easy and commonplace to record people's voices, sort of small phrases and things, so that if they can't communicate verbally, they can type, press a button and a pre-recorded phrase in that person's, without using that person's voice, come out, hi, can I have a cup of coffee or something. And a speech bank is something a little bit more sophisticated, where it is sort of freeform, so it enables you to type in words, freeform words and sentences and things, and then it speaks them in your voice. If you get the difference, a subtle difference, but a good important difference. It's something we need to think about now, because I need to pre-record my voice and vocalizations now, or before they degenerate any further. So we've got the best foundation to use in the speech bank. So we've got this info from the speech therapist, so they're going to look into that, and I should hear back in about from their initial assessment in a couple of weeks or so. Should be good.